As we've reported here previously, one of the worst places to be during this pandemic is locked up inside a prison or jail. In state, local, and federal detention facilities around the country, the same horror story is emerging of the unchecked spread of infection and inmates essentially being left to die. Inside one federal facility in Ohio, where at least 3 prisoners have been killed by the virus, one inmate with a smuggled smartphone recorded a plea for help.
It was all good like a couple days ago, right? So, all of a sudden, out of the blue, everybody just dying and getting sick and like this is serious as like, they literally leaving us in here to die. Y'all can social distance. We can't social distance.
You can social distance, he says. We cannot social distance in prison. In the latest episode of his MSNBC podcast, Into America, Trymaine Lee takes a look at what's being done to protect the people who live and work inside these facilities.
The fear is real. That's all. You like, prison is a place where, like, when there's tension, you can feel the tension in the air. You can feel the fear in the air. When you walk around, it's thick. It's thick.
Joining me now is MSNBC correspondent Trymaine Lee. Trymaine, you talked to family members of those incarcerated, including people who are incarcerated. What did you hear?
I'll tell you what, Chris, as the virus continues to spread across the country, so is the fear, not just of the folks inside of those facilities, but the families who essentially are serving time with them. Now, JJ Velasquez, the man we heard that clip of, he says that you can feel the tension and it's so thick in the air, but also that if folks on the outside can't get access to testing and proper health care and masks and protective gear, what makes you think anyone would care about those on the inside of prisons? Now, we know all of us on the outside who are social distancing, creating space between ourselves and other people, they don't have that option. They're living in close quarters. The inmate population is the most vulnerable population in America to disease. They're more prone to getting hepatitis and tuberculosis. But also, let's not forget, we can kind of keep them in their cells, on their blocks. But every single day, staff and corrections officers are coming in and out of the prison. So one of the main carriers of COVID-19 into the system are actually those who work inside the building, not just the inmates.
Yeah, and that's, I mean, we've made this point before, but you're seeing it now. This is a perfect example. There's 492 cases in Cook County Jail in Chicago, 2 deaths. And if I'm not mistaken, I think about half of those, a little more than half of those are inmates, and about 200 are correction officials and others employees of the sheriffs. It's not gonna stay there, even if you don't care about the, moral worth of people behind bars, which you should. The disease is not going to stay there. There's people moving in and out.
Chris, I'll tell you what is almost mind-boggling, but not really, because this is America and this is who we are. The Into America podcast dropped last night at 5 p.m. I tweeted about it. And if you check my mentions, people are saying they committed a crime. They deserve to be there. Do you want to let them out and rape and murder? Send them to democratically run cities. Never take into account that there are people who are working these facilities who will be coming out into the community day in, day out, visiting with their family members, right, who will then spread the virus. But also 95% of inmates currently, the 2.3 million people, of the 2.3 million trapped behind bars, 95% will at some point get out. So we're talking about this disease. It's behoove of all of us and the power structure to really make sure that we're taking care of those folks. If not, we'll all be paying the price for a very long time.
And also to that point, I mean, obviously there's a huge concern in a lot of cities are jails, right? So there's prisons where people are serving longer sentences. Jails, there's huge turnover in those populations. One of the people that died in Rikers, contracted the disease, was there for a minor parole violation, caught the virus, and then passed away. This is someone whose pre-trial was on a minor parole violation. And there are jails where people are cycling in and out throughout the entire country.
I mean, that's obscene and tough on many levels. One, not that it matters whether you're innocent or guilty. If you're in the charge of the state, you should be taken care of. But could you imagine being accused of a crime, landing in jail, and then not being protected and dying before you even had your day in court? But across the country, some state prison systems are trying to make sure that they limit the number of people who are transferred from the jail system into the state system. So in Colorado, where I spoke to the executive director of the Department of Corrections, Dean Williams, he said they tried to, limit that transfer of inmates. But their first positive COVID case this week was of an inmate transferred from the Denver City Jail into the state prison system. So it's layered, it's tricky, and it's all around bad.
Yeah, once it's in there, it's hard. Trymaine Lee, thank you so much for joining us tonight.